I'm David Gill, and I represent Northwell Health, based in New York.
Excellent.
And I'm Hattie Roche, and I am from an organisation called Home.
Well, for Northwell being a healthcare provider, we understand that it's really about our people that are going to make the difference for the care that we give to our patients. So we're investing in the experiences that our team members have so that they can drive the right experience for our patients and customers.
We only work within employee engagement and internal communications. And honestly, we do that, and I think someone asked the question earlier, that it is underestimated as a business tool. And I think that it just can completely transform an organisation and the way someone feels about coming to work in the morning. So I think if we can have that sort of impact, then it's a good enough reason. I think I'd rather answer this question the other way round, and I think that when we tend to try and tackle leaders, we show them research, and the story that we told today involved a piece of research for 2,000 people. It's very difficult for leaders to then say no to things when they understand the volume of feeling behind it from their employees. So I think actually using employee voice is the way to impact decision making in the C-suite.
I think there's a slew of research going well back before the early 2000s that supports it. But I think even with the C-suite, they've been bought into this concept of the talent and the need and the war on talent, and understanding that it's a critical fight, that every team member can make another choice. They don't have to go and work there. Right. So what do you want to do? You want to make sure that there's a level of satisfaction and engagement of your team members to have them come in every day. So we see it, and I mentioned this before, from the standpoint of patient satisfaction. We know that the work units that are more highly engaged have better patient satisfaction scores. They see stronger clinical outcomes, which, if we're in the business of saving lives, I think our patients would appreciate an engaged staff to help them do that. I would say the work is going to change and the expectations of our team members are going to change, and it's whether or not the organizations meet the team members where they are. So we referenced quite a bit about listening to team members. We will have to do that now more than ever, and not just at select periods of time that we as an organization stipulate. It's talking to your team. Mm-hmm. Just talk and be willing to listen. And that will be the first step in you starting your engagement journey. Because your team is going to be brutally honest, and then you have a responsibility to respond. And so a good portion of how we at least gauge our workforce engagement is through a survey measure. Mm-hmm. Now, we ourselves don't administer the survey. We leverage an outside vendor or outside partner. Yep. That helps sort of ensure a sense of confidentiality, that your specific results aren't going to be turned over. And then, quite honestly, it's just building trust over the years. Our initial scores or even our response rate wasn't as high, but until we started to show, one, that we were listening, we weren't sharing back information specific to any one individual or about any one individual, then the team members became a little more trusting. So we sort of stay true to the concept of, if you're going to give us your opinion, we're going to keep your opinion confidential, look at the results in summary, and use that to sort of make the right decision.
I think don't expect to achieve everything at once, and be very clear about setting a very targeted and focused objective up front.